There are dozens of painkillers. Each one works differently. Each one has different side effects. Here's every common painkiller and what they actually do to your body. Acetaminophen, Tylenol. Acetaminophen is in almost everything: cold medicine, pain relievers, sleep aids. How it works: it blocks pain signals in your brain and lowers fever. It's gentle on your stomach. Side effects: normal dose. Nausea, dizziness, rash, rare. Liver damage, only if you overdose or take too much. The danger: it's in so many products. People accidentally overdose by taking multiple products containing it. Long-term use damages your liver over time. Your liver processes it, and repeated stress on the liver causes scarring. Safe limit: 3,000, 4,000 milligrams per day maximum. Overdose starts at 7,500 plus milligrams. Ibuprofen, Advil, Motrin. Ibuprofen is an anti-inflammatory painkiller. It doesn't just stop pain, it reduces swelling. How it works: it blocks prostaglandins, chemicals that cause pain and inflammation. Side effects: normal dose. Stomach irritation, ulcers, heartburn, increased risk of heart attack and stroke with long-term use. Kidney damage, especially in elderly or those with kidney disease. Dizziness, headache, rash. Why the stomach problems?
Prostaglandins also protect your stomach lining. Blocking them leaves your stomach vulnerable to acid damage. Long-term use increases heart attack risk by 20 to 50% if used regularly for years. Your kidneys can fail if you use it too much.
Naproxen, or Aleve. Naproxen is stronger than ibuprofen and lasts longer, up to 12 hours per dose. How it works? Same as ibuprofen. Blocks prostaglandins and reduces inflammation. Side effects? Same stomach problems as ibuprofen, but worse because it lasts longer in your system. Higher risk of heart attack and stroke than ibuprofen. Kidney damage, fluid retention, causes bloating and swelling, can raise blood pressure. The danger? People think longer lasting equals better, but longer exposure to the drug means more damage to your stomach and kidneys. Long-term use? Not recommended for more than 10 days without a doctor's supervision. Aspirin. Aspirin is different. It doesn't just stop pain, it thins your blood. How it works? Blocks pain signals and prevents blood clots by thinning blood. Side effects? Same stomach problems as aspirin, but worse because it lasts longer in your system. Higher risk of heart attack and stroke than aspirin. Kidney damage, fluid retention, causes bloating and swelling, can raise blood pressure. Why it thins blood? Aspirin damages platelets, cells that clot blood. This is actually useful for heart attack prevention, but dangerous for stomach health. Long-term use increases risk of gastrointestinal bleeding. Elderly people who take aspirin daily have higher rates of stomach ulcers. Safe limit: low-dose aspirin, 81 milligrams for heart health. Higher doses, 500 plus milligrams for pain, should be short-term only. Opioids, morphine, codeine, oxycodone. Opioids are the strongest painkillers. They're also the most dangerous. How they work? They bind to opioid receptors in your brain and spinal cord, blocking all pain signals. They also trigger dopamine release, which feels good, which is why they're addictive. Side effects? Immediate: drowsiness, dizziness, confusion. Constipation? Extremely common. Opioids slow your digestive system. Nausea and vomiting, itching, respiratory depression, shallow breathing, especially at high doses. Long-term side effects? Physical dependence. Your body needs more to feel normal. Addiction? Psychological need to keep taking it. Tolerance? You need higher doses to get the same effect. Overdose death. Opioids suppress breathing. High doses stop breathing entirely. The danger?
Opioid overdose is now the leading cause of accidental death in many countries. One dose too high can kill you. Why prescribed? For severe pain, post-surgery, cancer, severe injuries. should only be used short-term because addiction develops quickly. Tramadol. Tramadol is a synthetic opioid. It's weaker than morphine or oxycodone, but still addictive. How it works: binds to opioid receptors and increases serotonin and norepinephrine, so it's part opioid, part antidepressant. Side effects: drowsiness, dizziness, nausea, constipation, seizures, especially at high doses or if you have a seizure disorder. Serotonin syndrome, if mixed with other drugs that increase serotonin. Addiction and dependence. The danger? Because it's weaker, people think it's safer, but it's still an opioid. Overdose is still possible, and seizures can happen suddenly. Topical pain relievers, creams, gels. Topical pain relievers are applied directly to skin. Brands like Bengay, Icy Hot, diclofenac cream. How they work: either numb the area with menthol, camphor, or reduce inflammation with NSAIDs that absorb through skin. Side effects: skin irritation, rash, burning sensation. Can be absorbed into bloodstream, especially if skin is broken. If absorbed, can cause the same problems as oral NSAIDs: stomach issues, kidney damage. The advantage? Less systemic effect. Doesn't affect your whole body as much. Safer for long-term use. The danger? People underestimate creams because they're topical. But if you use them on large areas or for months, you're still absorbing the drug into your bloodstream. Every painkiller works differently and carries different risks. Acetaminophen damages your liver. NSAIDs damage your stomach and kidneys. Opioids are addictive and can kill you. There's no perfect painkiller. Choose the one with side effects you can tolerate, use the lowest dose, and use for the shortest time possible. If you want every drug interaction explained, let me know. Subscribe.